Look, thank you everyone for coming. I just thought it's time to do a local update here in the Albury region and for Murrumbidgee Local Health District. We've just had the 3 cases this week notified from the Albury region, and that's, I guess, timely warning that COVID-19 is quite easily spread to our community. There was a link to for those people to Melbourne. So one of the persons had travelled to Melbourne. So it is a timely warning that we need to adhere to the new restrictions that we have about isolating if we've been to Victoria, and doing the right thing around that.
We understand they're all from the same household. Are they all still isolating at home?
Yes, they are isolating at home. They are still in their infectious period. Yeah.
Can you shed some more light? I know that they were in the community for up to potentially 72 hours. Can you shed some more light on where they might have gone or anything like that?
Sure. So we, as Public Health Unit, routinely do contact tracing. So we interview the people who are diagnosed with COVID, and we ask them about their movements. Fortunately, these people had very few movements. There were 4 close contacts identified, and those contacts have been tested and fortunately to date are negative, and are continuing to isolate for the period of 14 days from when they were last in contact with the cases. So that was it, so which is really, really lucky. So we were fortunate that those people didn't have a huge network of contacts.
Did they have the app?
I actually don't know. Sorry?
And Tracey, there's been a lot of talk about potentially a bubble and moving that border closer north just because of what's happening in Melbourne, but also those cases here locally. I know there's lots of footballers from O&M that are going to play in Wagga. I mean, are you in discussions? Are you having talks at what you sort of see as a good solution going forward?
Look, for sporting organisations, there is a thing called COVID safety plan specifically drafted for sporting organisation. That's available on Service New South Wales webpage. All organisations who wish to recommence need to have a plan in place so that they can minimise the risk to anyone, both players as well as patrons who might be attending. And of course there will be restrictions on people who can attend the numbers wise. So we are as a public health unit and New South Wales Health, we do look at some of those plans, and while we don't approve them as such, we can guide those organisations in how to better implement those plans. So we are involved in that. And certainly at the moment with the restrictions, obviously no players should be coming across from Victoria to play in the region, but everyone needs to have a plan, and so we can adhere to those things.
In terms of players going to Wagga then to play, is that reasonable from your point of view to be doing that?
Yeah, look, I think we need to be guided by the legislation, and I understand there has been some discussions from our Premier about Albury people travelling to Wagga, and if it's not necessary, we shouldn't be doing it. So that's the bottom line. If we can restrict our movements, then we will be actually restricting the spread of COVID-19 potentially, and also then putting less people at risk. So if we don't need to travel, we shouldn't be travelling.
So are you able to say if sport is a necessary reason to travel then, I suppose that's
Well, it's not really. I mean, in my view, my personal view, it's not a critical service. So people could play sport in their own community and exercise in their own community, but they should not be travelling broadly to do that.
Understandably, testing has ramped up a bit in the region. Can you give us a bit of an update on numbers of how many tests you've done up to date?
Yes, so in the last couple of days, the Murrumbidgee mobile testing van has been in Lamington at Mirrabina, and we're there again today. But in the last 2 days, they've done 600 tests, which is quite a significant number of tests to get through. The van's there and open till 8 o'clock tonight. The actual testing van is actually also going to be at the Albury Showgrounds on Saturday and Sunday and into next week. So it'll be around, so people, if you are symptomatic and you're feeling, you want to be reassured that you don't have the COVID, please make arrangements to go and get tested at that van. And of course, Albury Wodonga Health still has its testing clinic in Wodonga as well. So please utilise the local services to get tested.
Down at the showgrounds, is that the big operation down there, or is that going to be a fairly smooth transition to put all the testing clinic and
Look, the mobile van is used to moving around, and so it fairly seamlessly set up in Mirrabina, so it'll seamlessly set up in the showgrounds as well. Yeah.
What's the reason for moving to the showgrounds?
Look, I actually don't know specifically, but there's plenty of room there, plenty of ability for people to drive to it and access it there, so it's probably a really good location.
And Tracey, you mentioned 600. I mean, comparatively, what's that like to what we were seeing before the border closures?
Yeah, look, I understand that there is one clinic in Albury Wodonga Health was doing over 100 swabs a day. There is also another testing clinic at the GP practice in Wodonga, and I actually don't know these numbers for daily in the region. So it does seem to be an increase, and it's given people over on the Lavington area an opportunity to just be much closer to where they need to go to the testing van.
What's the turnaround time for the results? Do you know?
Yeah, look, it's somewhere between 24 and 48 hours. So people who are tested, we recommend that if they're symptomatic, that they and should be symptomatic to be tested, that they do isolate while they wait for those results to get back. They can sign up for an SMS result, so that makes the results come through a bit faster, and that is explained to them at the clinic, and they can just get an SMS within 48 hours generally to say negative, and if it's positive they'll get a phone call then from either the clinician or the public health unit.
In Wagga we've been told that turnaround has actually been a bit longer. It's been up to 3 days as most recently. Is there any reason for the delay in those tests up there?
Look, it just depends. The testing laboratory in Wagga has a limit to its capabilities, obviously, and there has been lots of swabs taken. So some of those swabs are sent to Sydney to get through the load. So it can kind of depend on the time of day the swab is taken, when it gets to laboratory, as to what run it will get on, or whether it gets to Sydney at a certain time and tested. Generally, though, they are taking about 48 hours up to.
Just with the New South Wales Health website had recently updated yesterday, just in relation to people in Victoria coming across New South Wales. Everyone who'd been in Victoria apparently was supposed to isolate. There's been a bit of confusion around that from what was on that website. Are you able to sort of, illuminate that for us and sort of give us a clear picture? Does everyone that was in Victoria in the past 2 weeks have to isolate if they're now in New South Wales? Or if they're from Greater Melbourne, or if they're from a border community? There seems like there's a bit of confusion there.
It is quite complex, and I do understand there will be some clarity coming out today from the ministry around that. Certainly anyone, and it's all around dates, and I'm sorry I don't have that bit of paper in front of me, but certainly if they had come to New South Wales from Victoria, excluding that border region for border travelling, but just can't remember the date. I'm sorry, I don't have a bit of paper with me that describe.
23rd of June, I think, was from what I understand.
So anyone who's come from Victoria from that date needs to isolate for 14 days. Sorry, I've got it sitting on my desk in my desk in my office for that date. So there is some difference. There is some nuances depending on the date people left Melbourne as to when they needed to isolate from. And that information should be on the website for people to access.
So it's for Melbourne, not for people in Victoria?
Yes.
As you can understand, there's a lot of people going across the border every day here. Yeah.
Look, there is some information from all of Victoria at the moment. If people come from Victoria now, they have to isolate. There was some certain dates, though, that it was only if they came from Melbourne they needed to isolate. And that information would be on the website.
How does that impact if it's all of Victoria, people from Wodonga crossing into New South Wales for work? What's the expectation there?
So there was an exemption in the legislation for people who live on the border, and so while they still need to have an exemption certificate to come over to the border, there's no problem getting that. They can travel to and from Albury, between Albury and Wodonga, if it's for work and normal routine business. That's acceptable.
Would you be able to answer whether or not that's isolating 14 days from June 23? It's backdated to that date, or do they immediately need to isolate for 14 days now? From 14 days onwards?
It's once again, it depends, as I said, from where you left Melbourne from and when you left Melbourne from, and that is the date you have left is where the 14 days starts from.
Just to clarify clarify, the one the other day in Wodonga that you had the case over there, is that case, the person gave an address as Wodonga, but they're in Melbourne, is that correct?
Look, I'm not familiar with the Wodonga case in particular. You'll have to talk to the Victorian Department of Health around that.
Yep, no worries. What's the status in relation to surgery now for people on the border? Is there any changes to that?
Well, certainly in Murrumbidgee, we were still surgery is still going ahead. However, if it's elective surgery and someone is a Victorian, has come from Victoria, it will be delayed if it's not essential until 14 days after they've left Victoria.
And what about if...
And then that's for Murrumbidgee Local Health District. I'm not speaking for Albury Wodonga Health.
And what about if you're in Albury and you've got surgery in Wagga? What's the situation there?
I understand that will currently go ahead.
Because we've been told that there was somebody that had surgery yesterday and they were on their way to that surgery in Wagga and it was called off because they were from Albury.
Well, I hadn't heard that information at this point. They are doing a risk analysis on everyone who attends those, so if that person had any respiratory symptoms as well, they would be delayed until they had a COVID test as well.
Yeah. I understand it may have been related to somebody coming from Sydney as well, so whether that person from Sydney was getting instructions not to deal with people from Albury, would that...
Yeah, look, I'm not sure of that circumstance, so I can't really comment on that, I'm sorry.
MLHD has been very clear with its staff who have travelled to Melbourne within a 14-day period not to obviously self-isolate and not to enter any health facilities or hospitals, and obviously that goes for the general public as well. Have there been any other staff members that have had to isolate within the past 14 days?
Yes, we've, of course, living on the border here, it's a sure thing that someone has been beyond the border towns into the Victorian areas, and yes, there are a number of staff who are isolating and working from home.
So just to clarify with the surgery, if you're in Albury as opposed to Victoria coming over for treatment and so on, or say Corowa, for example, with some of your other border communities, then you should be able to get treatment without any problem.
Look, my understanding, certainly anyone who needs surgery, essential surgery will get that. For elective surgery, at the moment I understand that New South Wales people are still being provided that elective surgery. However, of course, every day is different and the rules change quite rapidly, so that may change.
And the cross-border operation, have you got any role in that, in sort of providing any advice down there for what's unfolding at all?
Well, and my team is one of the part of the team who was screening at the XPT at the train station, and also my team is the group of people who are meeting Melbourne flights. So then screening the passengers to make sure that they don't need isolating and are well.
So that's still continuing with, obviously the XPT's now stopped in Albury, but the bus services coming up from Melbourne and so on.
We are actually screening people who are getting on the XPT at Albury to go to Sydney.
Personally, I haven't been out there this morning, so I can't say if they have been, but obviously there's been advice now for people to be wearing masks. The police that are checking those checkpoints in Albury, should they be wearing masks as well as the gloves that they already were wearing?
Yeah, look, the recommendation to wear masks hasn't come from an official source that everyone should wear them. There's been lots of debate around that at the moment, and we'll be guided by our Chief Health Officer in New South Wales, and that advice hasn't been given at this point. Obviously, if you are working with people and in a close quarters of people who may be infected, then as a healthcare worker we always wear masks when we're putting that risk situation. So I can't really comment on the police situation at this moment.
So in your hospitals, the staff wearing masks in all your facilities?
We have a process in place where people are screened at entry of coming into the facilities, and if they have come from Victoria, absolutely our staff will be wearing masks, and the people who screen wear masks of course too. So we treat them until otherwise known as potential COVID cases. Absolutely. All right, thank you.
Thank you very much.
Thank you.
It's a long one today, but thank you.
Thank you. Yeah, and that